Countries around the world were stepping up efforts to prevent a pandemic of a new coronavirus that has now infected more than 80,000 people, 10 times more cases than the SARS coronavirus. Believed to come from wildlife in Wuhan City late last year, the flu-like disease has killed more than 2,700 in China. But the World Health Organization, or WHO, says the epidemic there has peaked and been declining. Beyond mainland China, however, it has jumped to about 30 countries and territories with some 36 deaths. Growing outbreaks in Iran, Italy, and South Korea are of particular concern. In Europe, Italy is the front line with more than 322 cases and 10 deaths. The outbreak is spreading from its origins in the northern regions of Lombardy and Veneto, with new cases reported in central Tuscany, the coastal region of Liguria, and Sicily in the south. Spain reported its first case on the mainland on Tuesday, a woman from Barcelona who had visited northern Italy. A four-star hotel in Spain's Canary Islands was earlier locked down when a husband and then his wife tested positive. Turkish Airlines plane flying from Iran was diverted to Ankara on Tuesday at the Turkish Health Ministry's request, an aviation source said, and an aviation news website said one passenger was suspected of being infected by coronavirus. Health Minister Fahrettin Koca said later on Tuesday that none of the Turkish passengers and crew on the flight showed evidence of coronavirus infection. Iran's health ministry on Tuesday urged Iranians to stay at home as its coronavirus death toll rose to 16, the highest outside China. Among the 95 people infected are the country's deputy health minister and a member of parliament. Iran canceled concerts and soccer matches nationwide, and schools and universities closed in many provinces. Croatia also confirmed its first case of coronavirus infection in a patient who is hospitalized in the capital Zagreb. The patient had stayed in Milan from February 19 to February 21. Meanwhile, the WHO said countries around the world need to shift their mindset to preparing for an outbreak of the novel coronavirus and be ready to respond rapidly when it arrives. Dr. Bruce Aylward, head of the joint WHO-Chinese mission on the outbreak, told reporters on return to Geneva that China's mobilization to handle the virus outbreak showed how aggressive policy steps could curb the disease's spread. He added authorities should prepare hospital beds, isolation zones, and respirators for severe cases.
Around the world, people are thinking, oh gosh, how do we live with this and manage all this disaster, etc., instead of, gosh, this virus is going to come, it's going to show up in our country. We're going to find it within the first week. We're going to find every case. We're going to go after every contact. We are going to make sure that we can isolate them and keep these people alive so they survive the case. This is the way we've got to be thinking. It takes a real shift in mindset. And it's not a preparedness mindset, which usually thinks about how you prepare for eventual disasters. This is going to come soon.
Kat Dumaraos, UNTV News and Rescue.